Hello everyone, welcome back to Nursing Simplified. In today's lecture, we will be discussing an important topic from pediatric nursing, that is pediatric nursing introduction, roles, role of pediatric nurse, nursing process, and modern concepts. Definition: Pediatrics can be defined as the branch of medical science that deals with the case of children from the time of conception to adolescence in health and illness. It's the branch of nursing that deals with the children from time of conception till adolescence, where it includes the following stages like infants, toddlers, preschoolers, children, and adolescents up to 18 years of age, so they're concerned with the health and illnesses of the children. They mainly focus on promoting the health of the children, that means developing the health of the children, preventing the diseases or the occurrence of the diseases to the children, and treatment or giving care to the sick children or ill or diseased children. Concept of child health care. So child health care refers giving comprehensive care to the children. So, what is comprehensive care? Comprehensive care is a combination approach or combining care that is given to the child for promotion of the health, for prevention of the diseases, for the diagnosis of the diseases, for treatment of the diseases, and for ongoing management of the disease, and to provide continuous personalized care to the child. So that is called comprehensive care, and of course it is a team based approach. So not as only a doctor is the person that gives care to the child, not only the nurse is the person giving care to the child. It is a team based approach where the child gets cured or treated when they are treated in a team based approach, means the doctors, nurses, pharmacists, dietitians, surgeons, and all the allied health professionals take care of the child. They're responsible for the treatment and, and providing ongoing continuous care to the child. So, which is really needed for their physical, mental, emotional, and social well-being. So, which supports their growth and development, because children has to grow and survive. The main concepts of child health care are health promotion and prevention of illnesses. So, nurse plays an important role in prevention of illness by educating the family regarding the child health issues and child health needs, and how to maintain adequate health of the child, because childhood has become a separate phase of life. So nurse needs to educate the family regarding this. Health maintenance means maintaining the health of the child who are healthy and of course who are not healthy. So that means, so, maintaining the health of the children who are healthy and improving the health of the children who are suffering from either acute or chronic diseases. Health restoration means the children suffer from many of the infections, diseases, either can be acute or chronic. So, curing or treating those diseases and restoring their health to the normal is called health restoration. Another concept, modern pediatric nursing concepts. So, children are the major consumers of healthcare in India. Children always need special care to survive and thrive. Adults just survive, but children has to survive and thrive. So, for that, special care is needed. In that one concept, the modern concepts, the very first one is family centered care. So, previously, the healthcare to the children is provided as a strictly patient isolated system, like that the patients or the children are isolated from the parents and they are given care over there. But nowadays in modern concepts, child's family is also involved in giving care to the children or the patient. Evidence-based nursing practice. It is the systematic problem-solving approach which is evidence-driven through research. It's mainly useful for making the decisions to give care to the appropriate care to the patient. Technology assisted monitoring, the next one. The nurse has to enhance her skills here technically to provide personalized care to help in diagnostics and all. Next, developmentally appropriated care. It aligns giving medical care with a child's cognitive, emotional, physical developmental stage, where main focusing is only on reducing anxiety. The very main focus is on reducing anxiety and promoting the growth of the child. So that is developmentally appropriate care. And the next one is collaborative care, where nurses, physicians, allied health professionals, and families together provide care, child-centered care. Trends in pediatric nursing. Many noticeable changes have occurred in the field of pediatric nursing as we are discussing them now. So, the major trends in pediatric nursing are institutional care. Children were cared as adults in these hospitals. Giving care to the children in the hospitals is termed as institutional care. Family centered care. Sick children were not treated as patients. So, because now the care is shifted from hospital setup to home depending on the family, called family centered care. A traumatic care, it is providing the therapeutic care in the settings to eliminate or minimize the psychological or physical distress, because if when the child is hospitalized, so they will feel either psychological or physical distress. To reduce that, to minimize that, to eliminate that psychological or physical distress in children in their families is called a traumatic care. High technology care. The standard of health services towards the children are increased due to advancements in the medical field, especially diagnostic technology. So nowadays, the diagnostic technology available are like fetal blood transfusions, cloning, IVF, checking the fetal maturity, in assessing the health of the fetuses. So all these are advancements in the diagnostic technology. Cost containment. It is reducing the cost of hospitalization and reducing the mortality rates, reducing the hospital stay, and reducing the complications. Evidence based practice. So it is using the best solution related to nursing practice to give care and treatment to the child in the best possible ways. Nursing process application. Nursing process can be used to make a nursing care plan, right? Nursing process application and child oriented environment. So providing child friendly environment in the hospital by specialized skilled staff. And nowadays the hospital walls, rooms, and everything are like painted in cartoons, like images, child friendly uh, images, and also providing playrooms in the hospital. So all these are child oriented environment. Care ethics in pediatric nursing. Care ethics means respecting the child dignity and rights, so protecting and safeguarding the rights of the child, providing a safe compassionate care to the child, not just treating the child, providing a safe and compassionate care, maintaining confidentiality of the child or and the parents, so not exposing the things what they are where they don't want, and maintaining that confidentiality, and also involving the parents in decision making where it is beneficial for the treatment of the child. Planning pediatric nursing care. So planning pediatric nursing care, for planning a pediatric nursing care, so first we need to assess the health of the child, health condition of the child. So when we assess the health condition, then we come to know what are the problems the child is facing, what are the needs the child is left unmet. So we need to identify that needs. We need to set the priorities, what is to be treated first, what is to be given the first priority, and set a clear achievable goals. Not setting goals, everyone knows that, but we need to set the goals that are achievable. We shouldn't set the goals like the reducing the temperature of the child within an hour. That is not possible. So we need to set the goals that are achievable care goals. And after setting the goals, planning and implementing the planned action to reach the goals, and evaluating the outcomes regularly, whether there is any effectiveness in the treatment and the plan. Role of a pediatric nurse. Role of a pediatric nurse is changing constantly with expanding medical services, consumer demands, and technological advancements. So, pediatric nurse mainly acts as a primary caregiver. So, how does she act as a primary caregiver? Means by providing comprehensive care in all the levels like primary care, secondary level, and of course tertiary level or care, by providing care to the patient in all the levels. In that comprehensive care we call as primary caregiver. Nurse acts as a coordinator and collaborator, so maintaining a good interpersonal relationships with a physician, social worker, surgeons, physiotherapist, dietitian, and family to provide care to the child and to meet the demands of the child. Nurse acts as an advocate to safeguard the child's rights and provide best possible um, care from the health team to the child. Example like if the child don't eat properly, if he doesn't want that menu, if he couldn't take that, then consulting a dietary department and asking them, requesting them to prepare a special food for the child, and discussing the plan of care. So this is an example. Nurse has to safeguard the child's right, and best possible care has to be given on behalf of the healthcare team. Nurse acts as a health educator to educate the child's parents about the disease condition, the prevention of the illnesses, maintenance of the health, and regarding the ongoing treatment. Nurse acts as a consultant by giving or guiding parents about feeding, accident prevention, very particularly in toddlers, feeding in infants, and promotion of the health of the children. Nurse acts as a counselor, providing guidance to the parents in health hazards to the children to make proper decisions. And pediatric nurse case manager, organizing patient care, monitoring and evaluating for successful outcome. This is case manager. Recreationist, so by providing play facilities for the children, by providing diversion therapy for children to divert them from the thought of being hospitalized. So nurses acts as a recreationist. Social worker, nurse acts as a social worker by taking part in the social services or refer the child to the family welfare agencies for support. Nurse researcher, so to take part in the research activities and contribute to the changes in the nursing practice. Nursing process in pediatrics. So nursing process is a systematic, rational method of planning and providing individualized nursing care. As we know, there are 5 steps in the nursing process: assessment, diagnosis, planning, implementation, and evaluation. Assessment means collection of the child health data is called assessment. So the data can be subjective data and objective data. Subjective data means subjective information means the information that we collect from either from the child or from their or from his parents is called subjective data. Objective information means the information we collect through physical examination, what we observe through physical examination is called objective data or objective information regarding the child health. Diagnosis, identifying the problem and formulating a diagnosis, nursing diagnosis to plan nursing care. This is the diagnosis. Planning. So, to develop a care plan, how do we develop a care plan? First, we set a goal by goal setting, planning care, priority setting. Then we develop a nursing care plan. Implementation, putting the plan into action to achieve these already set goals here is called implementation. And of course, recording this implemented care. Evaluation, checking the results, evaluating the outcome of the effectiveness of intervention is called evaluation. Challenges in pediatric nursing, that's nothing but obstacles or the obstructions in the pediatric nursing. What are the major obstructions or obstacles or challenges faced in pediatric nursing? Means is very important. First thing is communication, because young children, infants, toddlers, and even preschoolers, they can't communicate properly. So communicate without proper communication, we can't. It is not easy to diagnose a disease condition. So communication with young children is a challenging thing, and managing the anxious parents, because parents, some parents feel very anxious regarding the health of the children. So managing such parents is a challenging issue. And sometimes in some hospitals there will be limited resources, proper resources and facilities will not be available for treatment, for giving treatment and care to the children, maybe in emergency situations. So that is another main obstacle in pediatric nursing. And managing the complex childhood diseases like Down syndrome or like HIV, or some congenital diseases, some genetic diseases, child abuse, neglect, some such type of complex childhood diseases is really very challenging to manage with. So, conclusion, pediatric nursing mainly focuses on holistic childcare, only childcare. That is really very important. And of course, the childcare which is ethical, safe, and family centered approach. And nurses play various roles in this. In that, key role is advocacy and care planning. And this field continues to evolve. The pediatric nursing continues to evolve with modern healthcare, because so as we have discussed, researchers were always being taking on, always being going on. So the field continues to evolve, continues to change along with the modern healthcare. So I hope this lecture helped you to understand the topic clearly. If you found this video useful, like the video, share it with your friends, and subscribe to the channel Nursing Simplified for more nursing lecture. So let's meet in the next week with another topic. And the next topic would be in pediatric nursing, the concept of preventive pediatrics. See you with this topic in the next session.